Hi, Jen Angot from Henry Ford Allegiance Marketing and Communications. As many of you know, February is Heart Month. So all throughout the month, we're going to be bringing you a series of videos on heart-related topics, and we'll just have our subject matter experts from the health system join us. So today we have Dr. Usman Khokhar, who is an interventional cardiologist at Henry Ford Allegiance Cardiology. Dr. Khokhar, thanks for joining us.
Thanks for having me, Jen.
Perfect. So why don't you start out by telling us, what does a cardiologist do?
Jen, cardiology is a branch of medicine which deals with cardiovascular diseases, essentially. And a cardiologist is a physician who takes care of the heart problems. Within cardiology, there is a subspecialty called interventional cardiology, which deals with catheter-based therapies of cardiovascular diseases, and that's what I do. I'm an interventional cardiologist with Henry Ford Allegiance Health.
Wonderful. So when should someone see their cardiologist as opposed to their primary care provider?
It's a very good question. Most of the time, patients are referred to cardiology service by their primary care provider after the initial evaluation. If the initial evaluation raises concerns for any heart-related problem, the primary care doctor initiates a referral to the cardiology practice, and the patient is subsequently scheduled to see a cardiologist.
So what are some of the first signs and symptoms of heart disease?
That's a very good question. So symptoms such as chest discomfort or pressure usually occurs in the substernal area or on the left side of the chest. These symptoms would include radiation to the left arm or to the jaw, associated with nausea, vomiting, shortness of breath, symptoms like palpitations where one would feel the heartbeat really fast. This can be accompanied by lightheadedness or dizziness or syncopal episodes, are the usual symptoms of heart disease.
So what are some of the things that we can do to prevent heart disease?
Once again, another very good question. When I talk to my patients, I talk to them about sort of a multifaceted approach. So the first thing I would say is early diagnosis and management of conditions that are risk factors for cardiovascular disease is important, and that's where good follow-up with your primary care provider and early referral to a cardiologist if any concern occurs for cardiovascular disease. Then obviously lifestyle. Maintenance of a good lifestyle, which includes a lifestyle which is free of smoking, a lifestyle which is free of heavy drinking, a lifestyle that incorporates regular exercise. That's very important. Diet plays a very important part also in prevention of cardiovascular disease. I personally recommend a Mediterranean diet to my patients, which includes ingredients such as beans and legumes, vegetable oil, olive oil, chicken, fish, whole grains and nuts. And so this is the diet that is known to be heart healthy, and there was a large trial that was done in the cardiology area that showed cardiovascular benefits in the long run. Also, a very important aspect is stress management. So if one can focus on stress management and keep stress at a low level, that also goes towards keeping good cardiovascular health.
These are all such great tips and things that we all need to be keeping in mind right now. So Dr. Khokhar, thank you so much for sharing this information with us, and stay tuned for more videos.
Thank you, Jen, for having me.